Actually, sure, it's more than the study on the monkeys. What they did at Oxford University, they already started a human trial looking at 6,000 participants by the end of this month. And what's different about them, why they're so much ahead of the game, is that they have a totally different vaccine than most of them out there. Most of them do use a tiny piece of the virus itself, but scientists at Oxford University actually are using another virus. It's called adenovirus. It's usually the common cold. It's a very, very harmless one. And they attach the protein spikes from COVID. So basically, they inject this virus into the body, and this adenovirus hijacks the cell, injects its DNA inside the human cell, and then it triggers an immune response. Also, they are going to have, by September, almost 40 million doses available. And there is an Indian company that already agreed to start making this vaccine on the premises that it's been already proven as safe. They used the same virus vector for another vaccine before, and that was used in 300 plus subjects, and safety was determined. Therefore, they are moving ahead with making it.
That's good. Louisa, we're just getting some breaking news. According to Johns Hopkins, the United States has just passed the million mark of cases of coronavirus. The million mark, a million cases. You think that possibly up to 3/4 of people here in New York, which is obviously a hot spot, may have been infected. Why do you say that?
Well, we had the antibody testing done that started 2 weeks ago. And the first phase of that study, they took randomly 3,000 participants from grocery stores. Those are shoppers, they are people working there. And they learned that we have 4 times more cases than we anticipated. So almost 25% of New Yorkers are actually positive and being exposed to this virus. But however, these numbers are very different from area to area. If you look at Long Island, it's only 17%. If you look at Los Angeles, it's only 3%.
Different story in Texas, different story in Louisiana. That's why some states are reopening and some, like here, are not. Very true. Doctor, thank you very much, Louisa. It's good to have you here.
Thank you, Cheryl.
All right. Well, we will